Okay, so here we're going to look at the muscles of the knee. Again, some of these muscles we would have already talked about with the hip due to the fact that they cross both the hip and the knee. So we're going to go through the different muscles. Again, obviously we're going to have some big muscle groups within this that act at the knee, and we'll make sure that we know that we need to be able to separate all the origin and insertions for each of the individual muscles within the group. So the quadriceps muscle, so basically the big muscle group that sits in the anterior part of your thigh. So it's four separate muscles, okay? And we're going to break down and show individual pictures and origin insertions for the four separate muscles. They all produce knee extension. Now, one of the quadriceps muscle, of the four muscles, one of the quadriceps muscles is a two joint muscle. So as we go through, see if you can think about, as we move along here, which one of the four muscles is the muscle that crosses both joints? So the one muscle that actually crosses both joints is the rectus femoris. So the rectus femoris, the origin is on the anterior inferior iliac spine. The insertion is going to be the superior patella through the patellar tendon into the tibial tuberosity. So if we look here, it comes through that tendon and comes down and inserts on the tibial tuberosity. The actions of the rectus femoris is it's going to extend the knee and flex the hip. Okay, now think about that for a second. Think of the general location and when this muscle shortens, why it would produce those separate motions. So some of the two joint muscles will produce the same motion at each joint. Some of them will produce different motions. In this case, we have a two joint muscle. It performs extension at one joint and it performs flexion at the other. You may also see and make note of this. There's also another head. The rectus femoris actually has two origin points. The other origin points you might see is the superior surface of the acetabulum. Sometimes some books will show that as that being a second origin point for the rectus femoris. Okay, two of the other muscles. So now the rest of the muscles in the quadriceps group are all single joint muscles. Okay, so the vastus medialis. Okay, so again, something to a name, vastus medialis. It's the portion of the muscle that sits on the medial portion of the quadricep. And there you have the origin insertion. Again, just knee extension for the rest of the quadricep muscles because they're all single joint muscles. You also have the vastus lateralis. So again, here we are on the lateral side, vastus lateralis, and you have your origin insertion there. So two different area regions of the quadricep. So make note of the origin and insertions that are on the slide, and then as we go along, I'm going to be eventually at some point showing you some, not in this discussion, but I will be showing you some model pictures for you to identify things on. Okay, and the last one, the vastus intermedius. Okay, now the vastus intermedius, you can see it here. So you wouldn't be able to see this in a full picture of the quadricep because it would be basically covered up. The rectus femoris would be basically right in front of it. So you can't see the vastus intermedius without the rectus femoris kind of cut away. Again, single joint, so it only is going to extend the knee. And there you have your origin and insertion as well. Okay, again, here's a picture showing you the different muscles of the quadricep. Okay, so again, so looking at these three right now, think to yourself, could you identify if I said to you, which one of the quadriceps muscles are all these? Think about for a minute, see by looking at these right now, if you could identify which quadriceps muscles they are in each picture. So take a minute, see if you could identify them. Okay, so as you're doing this, I don't want to have there be silence for too long. Again, orientate yourself to the picture. So, be able to notice, which side's the lateral side, which side's the medial side. Okay, so think of the identifiers that we've talked about with that. So by now, okay, you should have figured this is the vastus medialis here. This is the vastus lateralis. Now, this one comes right down the middle, but you notice it doesn't cross the hip. So if it comes right down the middle, it doesn't cross the hip. That's the vastus intermedius. Here's your rectus femoris, crosses the hip. So this is what I was talking about. So notice I said in the slide, I only initially showed one origin, but note that when you're looking at this picture, you can see there's two different origin points. So here's the origin point that was discussed in the picture. In the previous slide, the anterior inferior iliac spine. Then you have this origin here on the superior surface of the acetabulum. So another name they use for this, they call this the origin of the straight head. So this is the straight head here, and they call it the straight head because it comes straight down. And they have what's called the reflected head. The reflected head is the origin over the acetabulum. They call it the reflected head because it's a reflection of the straight head. So those are the four quadriceps muscles. So again, more pictures. Again, be familiar with being able to identify the different quadriceps muscles. Okay, the hamstrings. So again, another big group of muscles. Now we're moving to the posterior aspect of the thigh. The hamstrings are three separate muscles. One of those muscles has two different heads, so that's important to know. And the major motion at the knee is knee flexion. Now, do you remember what motion? Because all of the hamstring muscles, with the exception of the one head of the one muscle, all of them cross the hip joint or act at the hip joint. So what's the hip motion that the hamstrings are responsible for? Okay, remember the motion that the hamstring muscles do at the hip joint, it's hip extension. Okay, so the motion at the knee is knee flexion, but because, and if you look, so because of their origin, now they don't cover up. It's not like the rectus femoris where you have that direct cover up, but if you look here, okay, they cross the hip joint. So they're going to do hip extension and knee flexion, okay, is what the hamstrings are going to accomplish. Okay, now we look at the different muscles that make up the hamstring group and their specific origin and insertions. So again, they do all of them will do flexion of the knee and extension at the hip. We're looking here at the semitendinosus muscle. If you remember another interesting point about the semitendinosus muscle, it's also a part of another soft tissue structure group. Think about and remember what that group is. And I'll give you a hint. It has to do with their insertion point. Okay, now they're showing you here upper anterior medial surface of the tibia. That's why they're showing a dotted line, because this is a posterior view. So because they're showing this from a posterior aspect, they're going to dot the line because the insertion actually comes around to the anterior surface. So do you remember what the name of that group is? And if you remember from our previous discussion, that's the pes-anserine group. Okay, so again, when I'm bringing up these questions, if you're having trouble answering them, those are things you need to be reviewing. Okay. So it's the pes-anserine group. So another thing to be thinking about is what are the other two muscles that are involved in the pes-anserine. So think about that. Those will also be coming up in this discussion as well. Okay, the semimembranosus. So again, you see your origin and insertion. The actions remain the same. Okay. The origin of the muscle, so all of the hamstrings, with the exception of the head of one of the heads of the biceps femoris, which is the one we're going to talk about next, all originate on the ischial tuberosity. Now the semimembranosus inserts on the posterior medial surface. So you can see that's why it's a solid and not a dotted demarcation like it was with the semitendinosus. So the semimembranosus inserts on the posterior aspect of the tibial condyle. Another thing to note, I just realized this as I was going to flip over to the side. So we did talk a little bit, it's not mentioned in the actions up here, but remember we talked about how the knee does rotation. So both of the medial hamstring muscles, the semimembranosus and also the semitendinosus, both do knee internal rotation, which you think about it would make sense. They come down and insert on the medial side. So they will contribute to internal rotation of the knee as well. So that's an important point to note as we're going along. So both the semimembranosus and semitendinosus do that. All right, and then the last of the hamstring muscle group, you have the biceps femoris muscle. So the biceps femoris denotes that the muscle is going to have two heads. So note both origins. You have the ischial tuberosity like you have with the other hamstring muscles. So for the hamstring muscles, the origin point's easy. You're always going to have the ischial tuberosity. The only exception there is with the biceps femoris because there's two heads. You're going to have the lower half of the linea aspera as well. Actions are going to be the same. So flexion of the knee, extension at the hip. Now, as far as the action on the tibia from a rotational standpoint, think about it. You're coming down. Now it's a more laterally oriented muscle. So that's going to produce external rotation at the knee. So that's kind of an important thing to note as far as something slightly different about the biceps femoris is its contribution to external rotation at the knee joint. Okay, now we're moving on to some of the other muscles. So the Sartorius muscle is another two-joint muscle. So it crosses both the hip and the knee, okay? And again, we come down to its insertion. We're going to show another slide here with the origin insertions again, but look at where the insertion is. So it kind of comes across and inserts on that anterior medial surface. So again, what's this landmark here? What do we call this? It's the pes anserine on the medial surface, okay? So the Sartorius is one of the other muscles that is a part of that pes anserine group on the medial aspect of the tibia. Okay, so the Sartorius, again, flexion at the hip, flexion at the knee. So unlike the rectus femoris and all three hamstring muscles, the Sartorius muscle produces the same action at both of the joints. So it does hip flexion and knee flexion, okay? Unlike, say, the rectus femoris, which does hip flexion and knee extension, and the hamstring muscles that do hip extension and knee flexion. So this does flexion at both joints, okay? And again, you know, as you're trying to, you know, kind of get that concept again, look at the direction the muscle travels in and how it orientates itself with the rest of the body and with the joint surfaces. You're also going to do some abduction at the hip as well. So if you kind of look at the line of pull, it will work to abduct the hip. As well as doing the hip flexion as well. And again, note your origin and insertion points of the Sartorius muscle. Okay, the gracilis. Okay, so now we're going to look here. So you can kind of see the gracilis with some of the other adductor muscles, which that's one of the actions the gracilis is going to do. The gracilis also comes down and attaches on the anterior medial surface of the tibia. So the gracilis is the third member of the pes anserine group. Okay, so that's all the pes anserine muscles. So when I asked you about the pes anserine earlier, and we talked about it in previous discussions, you should have been able to name all three of those. So again, make sure you're keeping yourself up with the information and you're reviewing things as you need to. Okay, so the gracilis muscle. Okay, so again, here's a picture of the gracilis by itself. Okay, adduction of the hip. So it kind of functions as a hip adductor. Weak flexion of the knee. So we are going to consider it a knee flexor. It's not a very strong knee flexor. You can kind of see the origin insertion. So its origin point is very close to where the other hip adductor muscles are. So it's going to be, again, primarily it's going to be much stronger as an adductor than a flexor. It's going to be a stronger adductor of the hip than it is flexor at the knee, but it still will produce some knee flexion. And you can see down on the insertion point, again, there's your pes anserine. So the pes anserine goes from, superior and most superficial. It goes sartorius, gracilis, and then the semitendinosus. When you're looking at that, and there's some good pictures of that in your textbook. So kind of take a look at that. You can kind of see how the three tendons come down and orientate themselves with that. Okay, another knee muscle, very small muscle that sits in the back part of the knee, the posterior aspect, is the popliteus, okay? So the origin is posterior lateral femoral condyle and inserts on the upper posterior medial tibia, and it does both flexion and internal rotation at the knee. So one of the important things that the popliteus also does is it also helps, I had mentioned earlier, when the knee locks into full extension, the popliteus actually does, the rotation that the popliteus does actually helps in unlocking the knee from full extension. So that's another important point to note as far as the function of the popliteus is concerned. So it does kind of unlock the knee. Now, interestingly enough, the popliteus, as far as its action, so here you notice it says flexion and internal rotation of the knee. So there's actually two different rotational things that will happen here. So make note of this. So we'll do internal rotation of the tibia in the open chain, meaning that your foot isn't in contact with the ground. So when your foot's not in contact with the ground, it will internally rotate the tibia. If your foot is in contact with the ground, so you're in what's called the closed chain, so now your foot's in contact with the ground, it actually externally rotates the femur on the tibia. So it will actually work in both the closed and open chains, okay? So it will actually externally rotate. So if your foot is in contact with the ground, it will rotate the femur on the tibia, but it will be the opposite motion. It'll be external rotation, okay? So internal rotation of the tibia on the femur in the open chain, external rotation of the femur on the tibia in the closed chain, okay? So it's going to do two different actions there, okay? So if that confuses you or something, or you're not sure about that explanation, just send me an email, or I could, I could have any discussion with you further, even online, just even through a one-on-one collaborate session if need be. But again, just make note of that extra action point with the popliteus. So that kind of concludes our knee joint information. So again, make sure you note all of your different two joint muscles, their different actions. And if there's any questions about anything so far, just be sure to contact me.